You're listening to KPCA LP, Petaluma, California, 103.3 FM and online, kpca.fm, and email kpca@pca.tv. Snail mail, P.O. Box 2806, Petaluma 94953. I'd like to say hello to all of my Pilates lovers and future Pilates lovers. Welcome to my show, All Things Pilates, a show intended to inform, educate, and maybe even entertain. My name is Darien Gold, and for the last 24 years, I have faithfully been teaching the Pilates method and practicing just as long. And my goal of my show is to help you understand what is Pilates and what isn't Pilates, and give you my knowledge and my experience and workout tips and other kind of tips that can help you in your daily life. One of the quotes that Joseph Pilates said was, "You are as young as your spinal column." And it is a very fitting quote for today because I have a very special guest with me here, Dr. Ste Battaglino, and he is a chiropractor here in Petaluma. And he's been practicing for 14 years. And I asked him here today to explain to us about the spine and a healthy spine versus an unhealthy spine, and what one should expect to feel if they are having any kind of issue that they can't necessarily identify, but they know they feel sort of stuck in their body. And I hope that Dr. Steve can explain that. I know he can talk about chiropractic care forever, as I can talk about Pilates forever. And since we don't have much time, I better stop talking now and introduce you to Dr. Ste Battaglino. Steve, how are you today?
Doing great. Thanks for having me.
Oh, thank you for coming here. Okay, so right off the bat, the spine. Can you briefly tell us the components of the spine? What makes up the spine?
Okay, great question. So imagine in your mind's eye, because people don't think about their spine all that much. We have bones in the spine, vertebra. There are 24 vertebrae, and there is a disc, an intervertebral disc. It's like a shock absorber in between each bone, separating the one above from the one below. The disc allows us to move around, so it gives us flexibility, it provides shock absorption, and it separates the bones apart to create a little space where nerves can exit from the spinal cord. This is really important. I'll get to this more in a second. We also have joints in the spine called facet joints. They're little cartilage joints on either side of the vertebra, and it allows us to move around. So the nervous system is our control system. It's like an electrical system that connects the brain with the entire body. So that lives, the majority of the nervous system lives inside the spine and exits through the spine. So spinal alignment and proper structural position of the spine can have a big impact on how the nervous system is functioning. So over that, you kind of imagine an overlay of lots of different muscles, layers of muscles that are connecting and helping to move and support and stabilize the spine.
So if the spine is moving in a number of directions, and at some point somebody feels some sort of pain in a particular plane of movement, is it already too late to come to someone like you? Is it too late already when the pain shows up, or
No,
is pain?
that's a good question. I get where you're going with that. So usually frequently pain is the last thing to show up when there's a problem in the spine. So sometimes problems can be there for a long time, years even, before patients will experience pain. So your back should never be in pain.
Ever?
No.
Okay. Tight is one thing, but pain. Okay.
Tight.
Okay. Can you define pain?
Well, pain is the most frequent symptom that patients will come with, but sometimes it's not. Sometimes it's, like tingling or numbness or even weakness of the muscles. There can be a whole host of different symptoms, but, pain is a pretty common one. So that's one. And what is pain, or any symptom? It's just a signal that there's a problem with our body, and it kind of lets us know. So the pain really isn't the problem. It's more what's causing that problem. And so figuring that out and removing that cause, you're going to have a much better, quicker return back to your life, doing exercise.
And so if someone's coming to you, how do you assess them? How do you find out where that pain or tingling or numbing is coming from?
That's a good question. It's all magic, really.
Ah,
No, it's
nice.
We do a combination of digital x-ray. We have a digital x-ray system. We do thermal scans on the back. We do
What's a thermal scan?
Thermal scan is a way to discern if there's nerve pressure at a specific level on the spine. These nerves, as I mentioned, are the main nerves, or like the big trunks that come out of the tree. So there's a little branch of that nerve that goes up to the skin called the cutaneous branch. So if there's pressure on these nerves, there'll be a thermal distortion.
Reading?
So we'll be able to get an idea with that. So it's different layers of information. The orthopedic exam, neurological exam, it all kind of goes together with the x-ray as kind of a roadmap.
And the orthopedic exam what is that exactly?
It's, the orthopedic exam typically puts patients in a certain range of motion to see if it's restricted, to see if there's pain, to see, how things are moving, or see like what the body's doing, if it has, muscle spasm or things like that.
Well, along those lines, I was told by another chiropractor years and years and years ago that the joint needs to be moved. I don't know. Tell me if this is true. The joints need to move in 6 directions. So you have flexion and extension, and then side flexion, and then twisting. Is that?
There's 3 main planes of motion, X, Y, and Z axes. And then, it's like backwards and forwards and up and down and so forth. But the joints in different areas of the spine and body move with different ranges of motion. So some are like, for example, in the lower back, you don't have a lot of rotation. It's designed to be more of a powerful, support system down there. And so there's less range of motion. And typically, in the neck, you're going to have more range of motion. So it just depends on where you're talking about.
But I thought that the low back and the neck mirror each other.
The joints are shaped differently, so that the motion in the lower back is primarily flexion and extension. That's the main, components. And then in the neck, you have a lot more of a swivel. The joints are shaped differently.
So I'm thinking about when someone comes to me and they are telling me that their neck feels really tight. I know that obviously that there's maybe some kind of impingement or some kind of tightness in some plane, some movement that they can't do with their neck. But I'm wondering, because my intuition always says I'm going to start at the pelvis, because if something's going on in the low back or in the weakness of the low abdominal area, it's probably affecting what's happening up at the neck.
It can be, certainly can be.
So, I know there are some chiropractors that just do C1 and C2,
right?
Right?
Yep.
The atlas and the axis.
Uh-huh.
And they think that is just, if you just take care of those 2, then the body magically gets healthy.
Yeah. Uh-huh.
But so in terms of the pelvis, and I'm just going back to my work, if someone comes to me, let's say with their low back really tight, would I necessarily start there, or would I go to the neck?
It just depends. Everybody is going to be a storybook of different layers of injuries, what their genetics are bringing to the table. People are going to have different lever lengths and different,
What's a lever length?
Lever lengths, you might have like a really high waist, or kind of someone with shorter legs, or someone with a longer trunk. All these differences that we have as people, that plays out in the way that people will stabilize themselves, how they'll get injured, and all that stuff.
Can you tell me, generally when someone comes to you and they have some neck issues or some low back issues, and they're not necessarily coming off an injury, but they just need your hands and your knowledge, how long is the treatment before you would release them, for example, to someone like me or some other kind of resistance program where you're trying to find the strength bilaterally? And
well, that really is the question, isn't it? Because my take on exercise is that people that are exercising, patients that are exercising through that healing process heal more quickly, and they stay better longer, and the healing is more complete. So what I look for is always something that is going to be lower impact and more controlled, and go through a range of motion and build strength, especially core strength, but not push it over the edge to where they're getting re-injured or getting like flaring things up while they're trying to get better. So it's really that question, what you said, is finding that sweet spot and finding the right time to be able to release them for exercise and doing what they want to do.
And would you recommend, or do you, once you release a patient, do you have the teacher, the Pilates teacher in this case, sort of report back to you? Or that's a good, in terms of communication and keeping, because ultimately it's really about all of us wanting the healthiest, best for our clients and for our patients. And I think that personally, I think it's good to have the communication between the chiropractors and the physicians and other people who are sort of at the front lines before they release a patient to people like me. And it would be, I think it's advantageous for us to stay in communication. And maybe that's too idealistic because there's so many people that need us or need you. But what do you think about that?
I think it's great, provided there are laws under the auspices of HIPAA, for sharing health information. So as long as that's not infringed upon, I think it's really good to co-manage, because, people are complex. We want to look at, a lot of things that are not my area of expertise, like what their nutrition is like, what their stress level at home is like, and all that stuff. That all basically culminates in the stress that they're having to deal with. So our bodies deal with stress, by adapting. And if we're unable to adapt, we get sick in different ways. So we want to try and boost that immune system and boost that ability to adapt. And we do it through, maximizing the musculoskeletal system and the nervous system and the immune system.
And your office, I know, also offers various natural pain relief modalities. Is there anything that you can talk to about that? Or is it, I know you have essential oils. I mean, I don't know if that's part of it, or is that just to make your office smell good?
We don't actually sell them. That's my mother-in-law, Catherine Carl. A little shameless plug. I believe in them. I like the essential oils a lot, and I get a lot of benefit from it, but it's not my focus. And so my focus is on doing one thing really and being really excellent at it.
Yes.
And so I find that just doing that frees me up to really just concentrate on that and find other, practitioners that are expert at what they do and co-manage with them.
Yes. And hold that thought. I want all of you out there listening, In case you just tuned in, this is All Things Pilates. I'm Darien Gold, and this is KPCA LP, Petaluma, California, 103.3, and online, kpca.fm. Email is kpca@pca.tv. And lastly, snail mail, P.O. Box 2806, Petaluma, 94953. Okay, so I have another question. It's a big one. You ready? Okay. Please explain what a herniated disc is.
Herniated disc. There's kind of a spectrum where it's an injury, right? So there's a spectrum of seriousness there. Typically, we refer to it as a disc bulge. Once it gets to a certain level of severity, it becomes a herniation. So let's talk about that for a sec. The disc, it's an intervertebral disc, and we'll just refer to it as the disc. But it is a shock absorber, like a bushing in between the vertebra, and it is supposed to be lined up in a certain way. If it gets stretched or kind of out of position, that disc will start to swell. It's kind of like a sprained ankle. So what happens when you sprain your ankle, people? It swells up. The same thing happens to the disc. It's also soft tissue, and when it gets stretched, it suffers like a sprain injury. So it swells. The body reacts by locking that area down. So if you've ever had a disc bulge or disc herniation, you'll notice that the muscles in the lower back and all over will go into spasm. They're trying to immobilize that area to protect it, keep it from moving and getting hurt more. So the problem with that is, even though it's the best that the body can do by immobilizing it, discs need motion to stay healthy. They don't really have blood flow going to them. They get
don't have blood flow.
No, they have a little bit, but not to really give them nutrients. They get nutrients by the pumping motion of, it's like a fluid exchange. So just the normal, your normal day, going about your day, moving around and exercising and whatnot, is that mechanical motion that gets nutrients in and waste products pumped out. So if the disc isn't moving for any period of time, it starts to dry out, starts to accumulate toxins, starts to deteriorate, and the joints will start to wear out. So as far as disc bulges, I think it was a Harvard study of over 2 million MRIs that were done, they found something like 80 to 85% of the MRIs from this study had disc bulges, and most of them were asymptomatic, meaning the patients didn't have any symptoms at all. They had no idea it was even there other than the MRI. So
that was one of the questions I had for you is, do you always know, or do you always feel if you couldn't necessarily identify it as my disc is herniated, but you don't necessarily feel that kind of pain because
it just depends. Sometimes, if you have a herniated disc, or let's just refer to a disc bulge right now, because herniation is where that outer covering of the disc, the thicker, stronger wall, kind of splits. It gets fatigued over time. It doesn't get replenished. It dries out, and it splits, and it lets a little bit of that gel material in the middle kind of pooch out and poke out through that split. That herniation, the body really tries to
keep it
sequester it and wall it off and try and keep it from leaking out, because it can push on nerves. The big nerves where they exit, it can push on the spinal cord.
So if someone didn't feel pain, but they were feeling, let's say, tingling, or they were feeling numbing, it doesn't necessarily mean that there's some sort of degree of bulging, but would that be a big indicator?
It can be. It sure can be. A lot of times patients will come in and they'll say, my lower back is fine. It's totally fine. My lower back is strong, but my foot is going to sleep, and I'm having pain down my calf, and I can't figure out why. It's tingly. And so lo and behold, they have a disc injury that they're feeling downstream, so to speak, from that nerve. So it all just depends. Everybody has their own unique history and layers of these different experiences and traumas and accidents and things. So we really want to investigate and figure out what is causing that problem, and then kind of come up with a plan for dealing with it.
When you talk about the nutrients in the discs, when they start to dry up, what isn't being nourished? What isn't being nourished in that area, and how do you nourish it? Is it just through proper exercise like Pilates?
Yeah.
Is it just that, or is it also supplements and diet? Or
the disc is an interesting thing. Like normally, if you have cartilage repair that you want to do, glucosamine sulfate, chondroitin sulfate, MSM, all these supplements are really good for cartilage repair. But technically speaking, the disc is not cartilage. It's a type called fibrocartilage. So it's more fibrous, and it doesn't really, it's a little different than normal cartilage. To answer your question, really what it needs is, just enough water and enough motion to keep it healthy.
So hydrating and movement.
Yeah, but not just movement in your body, movement in that one specific disc. So if you have 24 discs and 23 of them are moving great, but one is locked up, it's really hard to discern that in your body. Unless you're really in tune, you're like, feels like it's stuck right there. So having an expert really kind of look at things and see what is moving properly, what's not, can be really helpful.
And so when someone comes to you and is describing to you what they're feeling in their, if not spine, down the leg, for example, what you were citing, then this is, and you don't exactly know what's going on. This is where you have all these different tests, because you need their history to figure out exactly how you're going to treat them before you can then treat them and then release them to someone who is doing this kind of functional exercise.
Yeah. Pilates is probably the best thing that I can think of for rehabbing in terms of exercise that meets the criteria that I was saying before, meaning, we want to have something that is low impact, that's controlled. A lot of my patients do CrossFit, and I like CrossFit. I don't want to,
Uh-oh.
But CrossFit, by nature of the way that the exercises are designed, sometimes people are vulnerable to injury, and I do see patients come in with injuries sometimes. And part of it is, if you're going to be physically active, you do run the risk of having some injury at some point, but you want to minimize that, and Pilates is an excellent way to do that. I think I got off of your original question.
What I am still sort of curious about is when you say that the disc dries up. What is that? Age?
They dry up. Okay, so age is definitely a factor. So, everybody's got a 90-year-old grandparent or an elder in their life that they remember being a little bit taller. And the fact is we do shrink, but it's a minimal amount.
Okay, now wait a second. Is that 100% of 100% of people? We all shrink?
I don't know about that. The effect of gravity so the discs, as we age, one of the things that happens to them, and people have different resiliency to aging, in their skin and in their body tissues, and the disc is one of those. But overall, the disc gets a little bit smaller. It dries up, and so you multiply that little height difference by 24, and it starts being like an inch or two, So as we age, you just want to keep the disc moving, and the way to do that is to keep yourself moving. So use it or lose it. You want to keep your body moving up out of a chair, and that it's got a great design. The disc is designed to handle, I don't know, however many millions of tons of stress in your life, of shock, axial compression, they call it. So that compressive force, that stress, it's designed to absorb it and dissipate it for your whole life. Now, if you get injuries, let's say you jump out of a plane and your parachute doesn't deploy completely, you're going to have like injured discs, probably up and down the spine. They're not going to age quite as well as they would normally, but they're pretty much low maintenance, but for the most part, other than that.
So you've talked a lot about the disc. Can you say something about the actual vertebra and the vertebrae? Because now I'm a little confused.
I confused everybody.
No, so the discs are in between the vertebra.
Right.
And then the facets are on the sides of the vertebra?
They're in the back. So the disc is in the front, as you're facing front to back. The disc is in the front half of the vertebra, and the facet joints that allow you to move are in the back. So they kind of move together as a complex. And
it's the facets that the muscles are inserted or originate on? Is it mostly the facets?
There are muscle insertions and attachments all over.
Okay.
The different parts of the spine. If you think about the different twisting and like leaning over to your side or leaning forward to tie your shoes, all these different movements require all these slightly different muscles, and so they're attached and
is there something called a facet syndrome?
Facet syndrome is when the facet joint becomes swollen and wears down to the point where it's creating not only pain there, but it can refer pain to other areas nearby.
Even if the disc is healthy?
Typically, the disc not being healthy is what causes it, but it can, you can get facet joint injuries, from a trauma.
But okay, but the big injury that we don't want to have is the actual disc.
You don't want to have injury to any of it, ideally, but the reason I put so much emphasis on the disc is because people tend to think about the bones an awful lot in the spine, so that they're
talking about the vertebra,
right?
Yeah,
right,
and adjusting the vertebrae all the way up and down. But you're saying
the disc is the soft tissue juncture that connects the bones. So the bones are pretty much fine unless you fall on a curb or something. The bone's going to be fine. That juncture though is soft tissue, so it's vulnerable to injury, and it's movable because we don't want to walk around like a stiff robot. We actually demand a lot of motion in our spine.
Right.
Well, whenever you have motion, it's going to open up the possibility of injury more. So things like your ankle get injured more because there's a great deal of motion in there.
As you can see, that Dr. Steve doesn't have much to say at all. And I'm going to ask him back because there's just so much about the spine. I think all of us need to know more. And when we do start a Pilates program, or even those of us who are in our practice now, just to have more insight and a more visual idea of how the spine is supposed to behave, I think more knowledge is where our power is. And I want to thank Dr. Steve for his time. And if somebody wants to get a hold of you, how would they do that?
They can visit us online at battaglinochiropractic.com. We're on Facebook. We've been voted best chiropractic office for 2015, 16, and honorable mention this year.
Nice.
And our office number is 707-559-4070.
Thank you so much.
Thanks for having me.
Yes. Okay, everyone. Now, if you want to get a hold of me and send me any kind of suggestions, or if you have questions, it's allthingspilades.kpca@gmail.com. You've been listening to KPCA LP, Petaluma, California, 103.3, and online kpca.fm, and of course email kpca@pca.tv, and our favorite, snail mail, P.O. Box 2806, Petaluma 94953. And one more thing I want you to remember, and I'm going to remind you every single time, I want you to lift your head. I want you to lift your spine, because they will lift your spirit. All right, everybody, have a great week.